The federal government has launched a national guideline for sodium reduction in processed and packaged foods as part of efforts to tackle health risks associated with excessive sodium intake. Speaking at the launch in Abuja on Wednesday, the Minister of State for Health and Social Welfare, Isaac Salako, said the guideline became imperative given the high consumption of sodium in many Nigerian households against the recommendations set by the World Health Organization. Let's now join Clearview News' Gloria Atta for details.
In Nigeria today, there is a high prevalence of non-communicable and cardiovascular diseases like cancer, hypertension, coronary heart diseases, and stroke, accounting for about 24% of total deaths recorded every year. Over the years, research and scientific studies have identified that the excessive intake of dietary salt, also known as sodium, is among the leading factors driving cancer and other non-communicable and cardiovascular diseases in the country. In a bid to address this growing burden, stakeholders from various ministries, departments, and agencies of government, as well as the civil society and non-governmental organizations, have converged on Abuja for the launch of a national guideline for sodium reduction in processed foods. Speaking at the event, the Minister of State for Health and Social Welfare, Isaac Salako, who was represented by the Director of Food and Drug Services Department at the Ministry, Olubunmi Arabiana, said the guideline became necessary following reports that many Nigerian households consume between 7 and 9 grams of salt daily, far above the 5 grams recommended by the World Health Organization, which has led to an alarming rise in hypertension, now affecting over 35% of adults in the nation's population.
These figures are not mere statistics, they are a clarion call for accelerated efforts, rigorous monitoring, and creative strategies. Our guideline serves as a blueprint for action and a beacon of hope amid these challenges. Today also marks another significant milestone as we not only launch the sodium reduction guideline, but also unveil the national guideline for food handlers' medical tests.
Other partners, in their remarks, noted that the effective implementation of the guideline will help in no small measure in reducing cases of cardiovascular diseases and NCDs, while calling for deeper collaboration between stakeholders for effective implementation and monitoring of the guidelines.
We reiterate our call on the Ministry for the effective implementation of these policies, including the regulation on TFAs, which was another major milestone by the country.
As the agency responsible for ensuring food safety and public health, NAFDAC is committed to supporting the effective implementation of this guideline. Our regulatory oversight will ensure compliance with sodium reduction targets, clear labeling of sodium content in prepackaged food products, and continuous engagement with the food industry to promote healthier alternatives to sodium.
As GHI, we are committed to continue beyond today, supporting the enactment of appropriate regulations to set salt target, which is a recommended intervention towards sodium reduction, with a proven high return of investment for the economy and ultimately healthcare.
Cardiovascular diseases claim lives of at least 19 million annually globally, making them the leading cause of NCDs. The development of a national sodium reduction guideline by the Federal Ministry of Health and Social Welfare is indeed highly commendable.
The new policy, which was developed by the ministry in partnership with some civil society organizations, including the Corporate Accountability and Public Participation Africa (CAPA), Global Health Advocacy Incubator, Resolve to Save Lives, among others, has been described as the first of its kind in Africa, as it introduces clear limits on sodium content in processed and packaged foods, ensuring compliance with global health standards. Stakeholders have expressed optimism that the guidelines will address a plethora of issues surrounding food safety in Nigeria and foster safer and healthier food practices across the nation. Gloria Atta, reporting for Clearview News.